Welcome to the resilience and innovation that's been taking place right here at Health Colorado Incorporated. As the regional accountable entity, our hospital transformation program is more than just a plan. It is a commitment of healing, care, and compassion that resonates throughout our region. Through dedicated efforts, we have been championing healthcare reform to exercise holistic, patient-centered practices and processes. Across our network of 14 hospitals, 11 have opted to participate in measures that require notification to Health Colorado. Of those 11, 6 send data through the Health Information Exchange via HL7 files, and 5 utilize an efficient internal tool named Provider Connect for manual uploads.
At the end of the day, we really had to look at who was already connected to the HIE and or who was going to be able to, without a doubt, get connected in time and with the least amount of barriers. And then we were looking at, okay, what hospitals are we concerned are not going to be able to make the cut for whatever reason. And we found that majority of those hospitals were our rural hospitals. And the reason for that being mostly because the EMRs were slower to connect or to interface with the HIE, or 2, timeline. And then come to find out that some of them weren't connected at all. And so we had to kind of step back and get them connected to just sending HL7 data. And so the goal really was to set up a track for them to be able to align it as close as possible to the HIE, so that fingers crossed, when they do get connected to the HIE, it's just a simple switchover. So we were able to build a spreadsheet that we hoped would mimic the exact same file format that we got in from the HIEs. That it was really important, number one, to recognize that we didn't want to add burden onto these hospitals, and we certainly didn't want to add a burden onto our team. The notification piece is only the first piece of the puzzle. The rest of it is, okay, now we have the data, what are we to do with the data?
We have worked closely with our care coordination entities to identify that there are information gaps in the current ADT data. The HTP notifications have been paramount, filling in details that allow our care coordination teams to follow through effectively once members have been discharged from the hospital. Holistic evaluation of these procedures has included a new look at our data processes from the perspective of the member's journey, from the intake forms that support the gathering of the required information, to the timely notification delivery to HCI, to member outreach prioritization and documentation. At the macro level, all of this has to be aligned in order to address the member's care efficiently and track outcomes accurately. But this is only the beginning. What lies ahead is a future-proof interface that tracks our interventions and outcomes in a way that will help identify, streamline, and increase the adoption of best practices.
My role is really to connect the dots. The Hospital Transformation Program brings the hospitals to the table in trying to improve and defragment the system. I think the difficult thing with the current system is that everybody is working hard to provide quality care, but they're working in their own silos. The system really, I think it improves by improving the flow of information. If we could standardize the flow of information between organizations, we have a better chance of helping people from falling through the cracks.
Through the combined efforts of the HTP, our staff are empowered with actionable data. Care coordinators quickly identify high-priority patients and tailor valuable interventions. Care plans become more effective, goals are more easily identified, interventions and outcomes are more trackable, and results become tangible.
When care coordinators receive the original ADT list, admissions, discharges, and transfers, it's a pretty extensive Excel sheet that has a lot of information, but not necessarily the right information. So it'll have a diagnosis, but not necessarily all of the diagnoses that are impacting a member. So for example, someone who may have been admitted to the hospital with complications of a COPD condition, it won't have that member may also be struggling with anxiety and depression, which is always going to make managing any chronic condition significantly more difficult for that member. So by merging these two pieces of data, Then, when a care coordinator outreaches to a member, they have all the pieces of the data and are able to more meaningfully engage that member, but also to build a care plan that actually addresses all of the needs that that member may have.
By enhancing the data within the ADT, we're able to paint a clearer picture, and the ability to have more information, or kind of that ADT plus, where we're getting specific diagnosis communicated, pieces of behavioral information that are communicated as well. It really helps to provide that context for our care coordinators. The recent enhancements of the ADT will really allow for that information to be actionable.
There are so many moving parts, different departments, different entities, different organizations, all with different measures, different goals, and finding where they come together and what they have in common was the most important part before we could implement any further changes. Nothing that we're doing with these data processes will work without relationships. And so focusing on building out intentional, organic relationships between all of the entities involved in that member journey, and making sure that you understand not just what's important to your entity, but also the entities that you work with every day and that the member is going to also interact with. We're not doing this to meet measures. We're not doing this for incentives. That stuff keeps the lights on and the doors open, but at the end of the day, none of us got into healthcare because we want to meet measures. We want to change lives and we want to help people. And the whole purpose of the hospital transformation program wasn't to create measures. It's unique because it actually builds the outcomes. And that's what's unique and that's what's exciting about it.
A story that has always stuck out for me was a story connected to the ADT. It's a story about a member who resided in a group home, and we noticed that he was using the emergency department every day. Kind of his typical behavior would be to stop at the gas station, pick up one or two of those big Monster energy drinks, which he loved, and he would drink those on the way to the emergency department as he was walking, and they would kind of take his vitals and see that he had a really elevated heart rate. I personally went to the group home to meet with the member, and I would literally just kind of sit with him, spend time, engage in conversation with him, and he was looking for connection. A solution that we had, he could pick up the phone at any time and call. He started to see his emergency department visits go down. He went from a high-risk complex member down to a low-risk member. I think without the ADT feed, we would have never known in real time, or as close to real time as we could get, the frequency at which he was utilizing the emergency department. So the ADT feed was integral. And I think by enhancing the data within the ADT, we're able to paint a clearer picture for our care coordinators when they're providing that direct outreach to our members.
For years in Southern Colorado, we've been trying to bring together our hospital systems so that we could have smooth transition for our members to decrease some of the over access of services. And this hospital transformation program is truly a beacon of change. Change is very hard. We have to work towards it, and we have to look at the outcome vision that we want in this transformation program. I am so proud to be part of this and to be part of this partnership. We've asked hard questions. We've dove for answers. We've made changes. But we came together as Southern Colorado saying we are doing this. I respect every one of our hospitals that have come to the table ready to work, and my team members at Health Colorado.
Thank you for the opportunity to partner with you in pioneering new ways to use data for improving lives.